So Jeremiah, I want you to kick off by telling us a little bit about yourself and a little bit about Valle Verde.
Yeah, so hi, I'm Jeremiah Hovsepian-Bearce. I got my start in gerontology in 2017 when I went to the University of Southern California and got my master's there in gerontology. In that same year, I started working at Human Good as an operations specialist in the home office. Since then, I've worked as the admissions coordinator at a couple of our communities in LA, and I've done my administrator in training at Piedmont Gardens in Oakland. And now I'm at Via Verde in Santa Barbara, and I've been here since October of 2019 as the administrator here. Via Verde is a 65-acre community in Santa Barbara. We are a life planned care community, meaning that we have all levels of care and help our elders through the aging process.
Great. So Cami, tell us a little bit about your background. Where were you in 1961? I bet you weren't born.
Oh my gosh. Thank you so much, Jeannee. We really appreciate you having us on. And Rob, it's so nice to see you and meet you. I've heard your voice a lot and a lot of shows
Let me just tell you this. A lot of them still bang around in my melon and pop out anytime. And look what happens to that sweet girl's face when Yakko shows up. Isn't that something? Gig in the world. All I got to do is start doing what used to get me in trouble in 7th grade, and that pretty young lady starts to smile. It's between.
Well, thank you for being here. I'm Cami Bonavita. I am an RN. I have my master's in leadership and management, and I've been a nurse for about 13 years now, I think. I received my degree in Colorado. Actually, I'm born and raised there. So in Denver, and then I moved here and I've done all sorts of nursing. I've worked in the hospital setting, excuse me, acute care setting. I've worked on orthopedic and neurological floors. My great love is probably hospice and end of life care, which I did for almost 8 years, both in the home, and I worked at Serenity House, which is an inpatient hospice house, providing end of life care, more acute end of life care. And that's my love. But I love caring for the elderly, especially those living with dementia and other cognitive impairments. And prior to this, I worked at Casa Dorinda as the assistant director of nursing. And then I was given this amazing opportunity to be the director of nursing at Via Verde. So I'm so happy to be here. It's a wonderful community. My first year as director of nursing has been very interesting. Jeremiah and I are sort of growing up together in this crazy pandemic. So we've learned a lot. I feel very fortunate. I have the best team. And then, Chris McNamara is always supporting us and guiding us in the right direction with the residents. And so we have an amazing community. Via Verde is incredible.
Jeannee and I have been doing a lot of these visits, and you talk to people really in your positions that have worked for 20, 30, 40 years. And I love when younger people, what's your message to younger people that are maybe contemplating senior living as a career that maybe don't know anything about it? What would you say, in just an elevator speech of what attracted you to it, and why do you think people should look at it as a career?
I think senior care is often overlooked by young professionals, young clinicians, because everyone wants to go into a hospital setting because it's exciting and fast-paced and whatever. But I think there's so much to be gained from elders and so much knowledge and wisdom. And we just hear the most amazing stories. And I really like senior care because you really get to know the residents, and there's so many great stories that they have, and you build more of a relationship than you would in acute care settings. Right. So that's what I love about it. And we have a chance to really make a difference in those that we serve. So it's just an honor to care for the elderly.
Yeah, and I think that a lot of younger people and younger adults kind of look at senior care in a glass half empty type of way. like this is the end, this is sad, but another chapter of someone's life, and we're really every single day engage with residents and help them live their best life possible. It's just another chapter in their life, and we get to be a part of it. And there's way more ups than there are downs. People just look at it in the wrong way, and we're hoping to change that.
And Chris, tell us a little bit about yourself and where you were in 1961.
The whole 60s for me, that decade, was one of because of my age and what was happening in the country was just phenomenal change, just absolutely phenomenal change. Some of it, for the better, of the whole civil rights movement. Some of it, not so much. The Vietnam War was, all-consuming for a lot of us, and then you turn around and there would be somebody landing on the moon. So it was just, it was mind-boggling, and I've got to tell you that there have been times in the last couple of years that for me it's felt like 1968 all over again. The amount of divisiveness in the country and unrest and social upheaval. And I thought, gosh, I really don't want to do this again, but here we are and dealing with it. I grew up here. I graduated from UCSB, and, the whole senior care has been something that I've been interested in for a long time. I took my master's degree in public health at UCLA and did. Am I getting an echo? I did my master's thesis on financing for alternative care, because at that time Medicare did not cover mammography. They didn't cover rehab. They didn't cover mental health. So we've seen a lot of growth, in the industry in the last many years.
And Kevin, tell us a little bit about yourself.
Okay, Kevin Ryan, and I'm a retired physician, radiologist, currently serving as president of our resident association.
Just curious, from being a radiologist, it's got to be fascinating the technology changes in medicine that you witnessed in your career. What are some of the biggest things that stand out to you as far as the way things are done now as opposed to when you first practiced?
You're exactly right. I was in the game for about 40 years, and my original training was interpretation of X-ray films. And at that time, all radiologists had to be trained in radiation therapy. That's the use of X-rays for treatment of things like cancer. And shortly thereafter, I remember we got into nuclear medicine, which evolved from the atomic programs. And then ultrasound, and followed by CT scan in the 70s, and then MRI. And then radiologists got involved in not only making a diagnosis, but in fixing things with the use of catheters and so forth, because it required a little bit of dexterity and a little bit of imaging comfort. And so I did a lot of all of those things. I tried to cover all of the fields, but it was an uphill fight. I think I must have spent a month of each year learning a new modality, which is very exciting. One thing was better than the last, and that's continuing right on now. And it was a very exciting field.
Well, thank you so much. And Rob, you get a follow with courage.
Boy, I'll tell you, I am so
truly, this is such a privilege to be on with you, lovely folks. I suppose I should start with respect to what I do anyway, with our friend Cami, and say, hello, nurse, because I think she will understand that. I am a lottery winner for sure, because I have had this wonderful career. I'm from just up the road in the Rust Belt. I'm from Motown. I have my pride and joy Detroit Red Wings hat on. You know, I have such a deep connection to the Red Wings. And to this today, I just turned 65, and when I cut myself, it's still red, just like the Red Wings. But in terms of where I was in the 60s, I was born in 1956. And like Chris, I recall the most incredible stuff, and of course, stuff that has shaped our world, and we seem to be revisiting a lot of it. I remember clearly, my father was in the National Guard during the 1967 Detroit riots, and that was a pretty tumultuous time. But then I recall with Jeremiah and saying we do we do things that because they're hard, or what was it, the back of your shirt?
We do things, we do the right thing even when it's hard.
Right. Well, that's a sort of a version of what John Kennedy said very clearly, that I recall, that we don't do things because they're easy. We do them because they're hard, which prompted NASA to put someone on the moon in 1969, 53 years ago. And I remember clearly where I was watching Mr. Armstrong step out. I was at my parents had a summer home up in Grayling, northern Michigan, the northern Lower Peninsula. And I was utterly transfixed, like pretty much everyone with a pulse, about the entire space program. Still am to this day. And I think, I haven't told my wife yet, but I'm thinking about taking every nickel I have in the world and finding a way to spend it on a couple of laps around the world before I punch my ticket. That's something that I would really love to do.
Jimmy Neutron. You're reliving your Jimmy Neutron days.
I am. I'm totally living my Jimmy Neutron days. And this is what's really wonderful, folks, is look what happens to Jack. Firstly, leave some handsome for the rest of us, my friend. It's not really fair. You got perfect hair, perfect smile, perfect skin. Come on.